Center for all of your hard work in putting this great webinar series together, and for everyone listening in and watching, of course, as well. I appreciate your time and the opportunity. Briefly, I just
Adam,
want to...
I'm sorry, I'm interrupting you. I forgot to say this before, but we are recording this session. So I just wanted people to know that we're making a recording of this so that we can post it afterward for people who weren't able to join us here in live time. And the recording is just showing the screen that you're seeing and our faces just for your reference. So sorry to interject and as you were getting going, but I wanted to say that part. Thank you.
Yeah, great. I just wanted to mention that I'm employed by the Mayo Clinic, but I don't have any other financial disclosures or any conflicts of interest. And so upon completion of this presentation, attendees should be able to list benefits to be expected from regular exercise as they relate to cancer prevention and therapy, to describe the key parts of a comprehensive exercise program, and to even develop a basic personal exercise prescription. Here's a brief outline of our discussion here. And I just want to start with some background information. Cancer is actually a group of nearly 200 diseases characterized by the uncontrolled growth of abnormal cells. And it may be caused by inherited or even environmental factors being exposures to things like tobacco smoke, radiation, ultraviolet rays from the sun, and other potentially cancer-causing agents that result from damage or result in damage to DNA, which is really responsible for helping with the development and function of organisms. And also important for our conversation today is the term survivor. We're going to be referencing it a lot, so I wanted to just review it briefly. And according to the National Cancer Institute, a survivor is one who remains alive and continues to function during and after overcoming a serious hardship or life-threatening disease. So in cancer then, a person is considered to be a survivor from the time of diagnosis until the end of life. So how common is cancer? Well, if we look back at data from 2015 to 2017, about 40% of men and women will develop cancer at some point in their lifetimes. In 2019, there were just under 17 million cancer survivors in the US, with over 22 million expected by 2030. And cancer affects people of all ages, of course, but it is most common in those who are 55 years or older, the vast majority of which, in fact, about 75% in that age group. And the benefits of exercise really have been known for centuries, and structured exercise is actually considered to be a foundation of primary and secondary disease prevention. Primary disease prevention meaning preventing something from occurring to begin with secondary disease prevention referring to preventing it from happening again. And if we look back historically within the US of individuals who unfortunately die of cancer, about a third of those can be attributed to things like diet and exercise. Another third could even be contributed to tobacco exposure. So genetics can certainly influence the risk profile for developing cancer. But what we know thus far is that most of the variation comes from factors that we may have control over or not inherited. And unfortunately, physical function in cancer survivors is generally less than normal because of losses in aerobic fitness, muscle tissue, and range of motion. And this can have long-term consequences. For example, even after 5 years post-treatment, about half of cancer survivors will still note limitations in things such as standing for prolonged periods of time, about 2 hours, lifting and or carrying 10 pounds, walking relatively short distances, about a quarter of a mile, and also kneeling and crouching. So some things that do have some functional limitations or functional impairments to day-to-day living. And unfortunately, individuals with cancer are also more likely to have other or develop other diseases such as cardiopulmonary disease, osteoporosis, diabetes, and others. And unfortunately, exercise can be helpful with those things as well, which we'll talk about a little bit later. Now, if we look back in time, cancer survivors, similar to other groups such as those with heart disease, were essentially told to rest and to take it easy, which nowadays is almost the exact opposite of things that we'd want to tell cancer survivors in most instances. And in fact, only recently has exercise gained acceptance as a possible additional supplemental therapy for cancer. And in fact, the American College of Sports Medicine and a Dutch source, Cancer Rehabilitation, concluded that exercise should be recommended to all cancer survivors. So a big change in stance seen there throughout the years. But importantly, what does the research say about the safety and effectiveness of exercise for cancer survivors? Well, exercise has been found to be a safe and well-tolerated therapy. Significant improvements have been noted in fatigue levels, exercise capacity, which is the ability to perform exercise, depression and quality of life. And exercise is actually associated with decreased risk of developing cancer in the first place, about 10 to 42% less risk, in fact, for 13 different types of cancer, and even improved survival after being diagnosed. When comparing survivors that are most to least active, actually the risk of dying from cancer is decreased by 26 to 69%, according to recent literature. Again, this is comparing those who are most active to those who are least active. And the risk of dying of any cause actually is decreased by 20 to 45%. So what are some of the benefits that participants might expect to realize with a regimented exercise program? Well, as I just mentioned, decreased risk of death from any cause, improved or decreased anxiety and depression, decreased risk of falls and injuries, particularly in older individuals, improved fatigue levels, which sometimes might seem counterintuitive that exercise would improve fatigue, but it certainly can. And a number of different improvements in body composition, such as decreased fat tissue, improved bone health, and increased lean tissue, which is important for day-to-day functional tasks. Cancer survivors who exercise regularly will also help to improve their cardiorespiratory health, which is a really important marker of outcomes and survival, even improve cognitive function, improve lymphedema control or swelling, also improve strength, flexibility, and improve quality of life overall. So just a snapshot of some of the things that can be achieved. This is a look at our exercise center here in Rochester on our 4th floor. It houses our cardiac rehab center and our cardio-oncology exercise program. This picture was taken prior to the COVID pandemic. As you can tell, without all the masks and not much distancing. I'll show you a picture later on of what our center currently looks like. Next, I'd like to review just some important considerations for those looking to start or maybe further their exercise programming. Again, I think it's important to acknowledge that cancer survivors should avoid physical inactivity even during and after treatment. What we know is that only about 10% of individuals going through treatment are actually physically active, unfortunately, only about 20 to 50% afterwards, despite the known benefits. And also, exercise guidelines for cancer survivors are very similar to those for the general population, meaning there aren't any limitations per se beyond what we would take into account for different treatments that people underwent, how they're feeling, and what their goals are. And of course, patients may experience some treatment-related side effects that limit their ability to exercise. So sometimes working with a professional can help you to identify these things and adjust the program accordingly. Also, different cancer populations may require special precautions. So for example, someone who underwent surgery for breast cancer is going to have different considerations to keep in mind than perhaps someone who underwent therapy for prostate cancer. And a large number of other examples exist. So it's all on an individual basis. No two experiences will be the exact same. And so with this in mind, it is important to keep in touch with your healthcare team as you move forward with starting and maybe starting new exercise regimens. I'd also like to identify several principles that I like to keep in mind and I like to share with people when they're thinking about how to go about exercise. And the first is being specific. So what I like people to do is to take note of the physical qualities maybe they're hoping to improve or some of the specific things that they're wanting to accomplish. For example, if someone is wanting to just be overall more fit, able to do things like aerobic activity, strength requiring activities, or being flexible, then a well-rounded program will certainly suffice, targeting all of those things. If someone, however, is looking to specifically improve their strength, they're already doing a really good job of aerobic exercise, it's not going to be of much benefit to do more aerobic exercise. So we need to incorporate the things that are going to help us match those specific goals. So again, training specifically. Also have to keep in mind that changes are reversible. The body does an outstanding job of adapting to greater stresses that we put on it through exercise. That's what accounts for improvements in fitness. But it's equally as good as adapting to less stress, or deconditioning is another way to put it. So when we do adopt these new changes and we're doing a good job of exercise, we have to be sure to keep up those efforts to maintain those benefits. We also want to make sure that we're progressing reasonably so. Otherwise, we might find that we're reaching a plateau or we're not quite reaching the potential that we can. So there are a number of things that we can do practically to gradually progress you without overdoing it or underdoing it. I also encourage people to incorporate a lot of variety into their exercise regimen. Otherwise, you might hear of people getting a little bit bored with their routine. Maybe they're doing the same thing time after time and they end up getting some sore muscles or joints. So for example, if someone is on a really nice walking program, they're walking nearly every day of the week, I would encourage that individual to really focus on flexibility, incorporate a couple days of cross training, perhaps in a pool or on a bike, so that they're not only giving themselves some mental variety or a mental break, but also using their body in ways so that they're not going to expose themselves to repetitive injury types of situations. So those are just some things to keep in mind, again, as you're looking to take your program to the next level or start one in general. And so with that, I'd like to review some specific recommendations for different categories of fitness, meaning aerobic or cardiorespiratory training, strengthening, and flexibility. And I'm going to break them down into 4 different parts, 4 different letters. It's called the FIT principle, F-I-T-T, where frequency is the F, I is for intensity, the first T is for time, and the last is for type. So for aerobic exercise, we encourage patients to do this at least 3 to 5 days per week, preferably even most to all days of the week. Certainly giving the opportunity to take a day or 2 off, especially when just starting. Frequency is a really important part of the big picture. For intensity, we recommend that people would exercise at moderate to vigorous levels. Moderate exercise is simply an intensity, be it when walking, swimming, biking, whatever it is you're doing. It results in your breathing being elevated, you're noticing some fatigue, but you could still carry on a conversation. In other words, you could talk but not sing. If you could sing, you're probably underdoing it. Vigorous intensity, on the other hand, would be exercising at an intensity that is noticeably causing maybe even some shortness of breath. There are places for both of these, but in general, that's what intensity would look like, and we'll talk more about this shortly. Time, again, in general, would be 20 to 60 minutes, we'd recommend. Some people start with 3 to 5 minutes a day. Maybe they're getting started, maybe they're very deconditioned or have other limitations. 3 to 5 minutes might be a reasonable starting point, just doing that a few times per day. Other individuals might be very well versed in exercise and could start out doing an hour or more right away. Again, it'll be individualized, but in general, 20 to 60 minutes is very reasonable. Kind of the gold standard for aerobic exercise is to work towards doing at least 150 minutes per week of that moderate intensity. Vigorous intensity can also be incorporated, but I like to say that it should first be approved by your healthcare team. The vast majority of individuals, cancer survivors included, can take part in vigorous exercise such as interval training, but there are just a few things that we like to sort out first before instructing people to do this. Now, the type of exercise for, again, aerobic training mainly focuses on rhythmic movement involving large muscle groups, which might be examples that I've already mentioned, but also things like the elliptical trainer, rowing machine, anything really that you enjoy. There isn't one that's necessarily better than the other. The most important thing is that you enjoy it and that it's well tolerated. As far as progressing, in a very important part, if someone's starting out with, say, 20 minutes a day, I'd encourage them to try adding 1 to 5 minutes per session or week as tolerated. So let's say, for example, I'm doing 20 minutes today. It feels like a good challenge. I would maybe try anywhere from 21 to 26 minutes the next time, building up gradually. That, again, has been a proven way to implement progression without overdoing it. This is a chart that is called the Rating a Perceived Exertion Scale. It's a very important way for individuals to monitor their intensity. It ranges from 6, as you can see here, which would be my exertion right now. I'm just sitting here reviewing some slides with all of you, not exerting at all. 20, on the other hand, would be extreme exertion to the point where I feel like I'm going to collapse. With everyday exercise, we don't want to be on either end of that spectrum. Again, this is a perceived workload that considers everything from my breathing, leg fatigue, any aches or pains, all into one number. Moderate intensity training would be a 12 to 14 on this scale. Again, I feel like I'm able to converse with someone next to me, but it also feels like a good challenge. Interval training or vigorous training would be more in that 15 to 17 range, where it feels like even after maybe a minute or two, you're going to need a bit of a rest because it's such a good challenge. Now, oftentimes with intensity, people ask me about target heart rates. What should my target heart rate zone be? What would you recommend? And in short, we don't ever really use target heart rate zones to prescribe exercise unless we have a very recent clinically supervised exercise test. The reason being is that's what we would get our peak heart rate from. When you're using exercise equipment, maybe at a gym or at home, there's oftentimes a nice, neat little chart that says if your age is this, your target heart rate zone should be this. That comes from estimated information, oftentimes an equation like 220 minus your age that gives us this theoretical predicted max heart rate, but it's open to a lot of estimation error. In other words, if you use that, it might be right on, or it might be causing you to over or under exert. The other thing to consider is that people are on medication sometimes that affect their heart rate. A very common one we experience or work with is beta blockers that can decrease heart rate by 10 to 30 beats per minute. So again, I wouldn't necessarily worry about reaching a target heart rate zone unless there's a very recent stress test available, and that would be implemented if your doctor requested it or needed it. For those who really like to monitor heart rate anyways, what I suggest to them is to simply keep track of what it is during your workouts. That way, you'll kind of develop a lot of these data points, and you'll say, well, usually when I'm working out, my heart rate's between this and this. That's very valuable also. Be it moderate intensity or vigorous intensity, that's a good way to go about it without being overly maybe obsessed even with keeping it within a certain range. So that is for, again, aerobic exercise. Here's a look at a couple of individuals doing what looks to be maybe even some interval training. And we like to post that scale that I just showed you on all of our exercise equipment so that patients can often refer back to it to make sure they're at the right level. How about resistance training? This is oftentimes called weightlifting, where you're aiming to improve your muscular strength and endurance. Typically, this will be performed 2 to 3 days per week, and ideally even on non-consecutive days per week so that you allow your muscles to rest in between. Now, some people like to exercise every day when they're doing weightlifting, and that's okay, but I'd encourage those individuals to alternate muscle groups, maybe upper body one day, lower the next, core the next. Otherwise, if you want to get it all done in one bout, every other day is sufficient. The intensity, again, what we recommend is to fatigue, but not failure. In other words, it feels like a good challenge. You get kind of a comfortable burn. You might be able to kind of associate with that. And again, you can use that perceived exertion chart to gauge how hard you're working. Other ways to go about it, if you're working with fitness professionals, they might determine a 1 repetition max or how much you could lift in one lift and give you some zones based off of that. But it doesn't need to be that in depth for most individuals. Again, it should feel like you're reaching a point of fatigue, but you don't feel like you have to drop the weight or that you're having to hold your breath, nothing like that. One way to determine if you're working at this appropriate zone is how many times you can lift the weight. It might be your body weight or others, but essentially, we like patients to be able to lift it at least 8 times. If you can't do it at least 8 times, it's probably a little too heavy. And you should feel tired by the time you hit at least 12, maybe 15 repetitions. If you could do 20, 30, 40, it's probably a little too light, which, I mean, that's okay, but you could just get more work done in a shorter period of time, a little bit more efficient with your time, in other words. And oftentimes people can rest from 1 to 3 minutes between exercises. That should be adequate. So let's say I go through a number of exercises, like one for my arms and then my legs and one for my core. That would be called 1 set. I did 1 time through each of those. For beginners or people who are hoping to maintain or maybe improve just a bit, that's perfectly fine. If you get more into it and you really enjoy it, want to progress more, even 2 to 3 sets is fine, even more than that for some. And that can be individualized based off of the person's goals and needs and limitations and so forth. So again, between 8 to 12 times, you should be able to lift it. You want to select exercises that focus on all major muscle groups. So again, chest, back, upper body, lower body, core, everything, so you're not neglecting any particular area while still respecting any muscle or joint issues that might be in place. So that is a summary of resistance training. And when choosing different types of equipment, never has to be fancy. Body weight exercises are great for things like body weight squats, calf raises, modified push-ups, things like that. But elastic bands, machines, hand weights are all great as well. Whatever you have at your disposal will most often suffice. Even during the height of the pandemic, we did a lot of virtual-based consultations, and we'd have people use fluid containers such as a milk jug or juice jug filled with water. And then we determined the weight of that, and they could use those if they had nothing else. So again, it doesn't have to be fancy or expensive. Here's a look at an individual doing the leg press. It simulates squatting. So you'll encounter these types of things in clinical fitness settings or gym settings, all kinds of nice things that can usually accommodate all types of ability levels and experience levels. And another important type of training to consider is flexibility, right? Being able to move the joints and muscles through a full range of motion. This should be done at least 2 to 3 days a week, preferably all if possible. And the stretch should be done only to the point of tension, never pain. We don't want stretching to hurt. And there are a number of different types of stretching regimens, different ways to go about it. Oftentimes, and probably even the most common, is what's called static stretching, where you simply hold the joint in place for an extended period of time without bouncing. So it might look like an arm stretch where you're holding your arm across your torso and counting to 15 or timing it. That allows you to get the benefit of that stretching exercise. If you do it too quickly or if you bounce, it might be counterproductive. So you want to hold it for an extended period of time. And similar to weight training or resistance training, you'd want to incorporate stretches that focus on the major muscle groups and joints. Again, entire body, think of it as. And you can also supplement with things like Tai Chi, yoga. Again, you'll have to approach those on an individualized basis, but oftentimes those are really nice ways to incorporate some of these things while adding in some variety as well. And also, before we discuss a program that we offer, you might also consider really focusing in on areas that remain tight from perhaps a therapy that you underwent. It might be surgery, it might be others, but oftentimes physical therapists can do a really excellent job also in restoring full range of motion so that you're able to participate in things that you're wanting to accomplish and moving forward towards those goals. And so generally there are several different groups of cancer survivors. One may go to their provider and say, I'd really like to get back into my exercise regimen. I'm very experienced with it. I just need the okay. And the provider might say, that's great. Start out gradually, progress as tolerated. They're ready to go. Another group might also get the okay. And they say, start out gradually, have fun with it. Let me know if you have questions. But the individual might think, well, I'd like to have a little bit of guidance. Perhaps I'd like a little bit more supervision so I know I'm doing things safe. And another group, the physician themselves or provider might say, I think you should exercise, but I would like you to have some clinical supervision. All right. For the latter two groups, we offer a program that can help fill that need. We offer a cardio-oncology exercise program here. We essentially serve all cancer survivors at any point in the survivorship spectrum, including those going through therapy currently, those who are post-therapy, really, again, any point in the spectrum would be considered eligible. We might do some conversation to see if there are other appropriate avenues, but in general, just about anyone can participate. The team is comprised of doctors, nurses, and exercise physiologists, all trained and working with cancer survivors. And it's comprised of course, clinically supervised exercise. It might be one session, it might be more. With that comes along individualized exercise prescriptions, again, catered towards each unique case, very important. It also includes some physical and well-being assessments to help us track where patients are at and also track their progress. One of the programs we offer is patients can visit with us one time, and we'll talk about their cancer history, treatments that they underwent or are currently going through, any concerns, limitations that they have, and then provide them with that individualized exercise prescription. And what we can also do is exercise right on site here, allowing you to take part in aerobic exercise, strengthening, get a feel for what it looks like practically, all right? And we also offer an extended program for those who feel like they might get some additional benefit from a longer period of time with us, where you can attend even for up to 6 weeks, working with us, gradually adding in new features as time goes on. We realize that a lot of individuals live out of state or maybe not even within driving distance, so we do offer video visits as well. Those can take place just over Zoom also. It's been pretty popular since the COVID pandemic, so that's another service. And importantly, a lot of specialty consultations. We work closely with physical medicine, physical therapists, cardio-oncology practitioners, and other support services, oncology trained dietitians. We work closely with social work. So a whole host of individuals. This is just one example of programs out there. There are many cardio-oncology exercise programs throughout the United States. And so in summary, and I'd like to reinforce that exercise has been deemed safe both during and after treatments. Currently, however, only a small percentage of people during treatment exercise, and certainly less than ideal even afterwards. Exercise guidelines, remember, for cancer survivors are similar to those for the general population. We don't want to give cancer survivors the impression that they should avoid exercise, because in fact, it can be very, very safe to do so and highly encouraged. Just have to make sure we're approaching it right and taking some considerations and applying them to each individual's program. Comprehensive programs, including the things we talked about and some other things, provide a wide array of preventive and therapeutic benefits. But of course, we always encourage touching base with your healthcare team before starting a new regimen. And so I know it's a lot of information in a pretty short period of time. We can talk all day about these things, but I hope that's helpful with giving some insights into some of the core components of it. And I'm certainly looking forward to any questions you have and starting some discussion here. So thank you for your time. I appreciate it.
Well, thank you, Adam, for all of that information. Lots of good statistics and research to support what you say. Lots of good motivation too, just as far as starting where you're at to continue to go and reaping the benefit, whether you're a survivor or haven't experienced cancer and just want to know that exercise thwarts cancer just as much as not smoking and some other things that we really know in general everyday life are good cancer prevention measures for all of us to take. So Adam said that he would be available for some question and answer time. So if you want to send a question in, if you can send that question through the chat function. So one person has asked, do you need a physician referral to enter the program, and is it covered by insurance? I think the insurance part probably depends on who your insurer is, but you probably can answer better on the physician referral portion of it, Adam.
Yeah, it's a great question. To enroll in our program, we do require a physician referral. Then that individual serves as someone that we can touch base with should any questions come up, or we just want to make sure that we're doing things in line with the best possible evidence in mind. Yes. And as far as insurance, you're exactly right. What we find is that a large percentage of our patients do have some coverage. We just encourage that patients to reach out to their individual insurance provider to verify that. But again, most of our patients do receive coverage via one way or another.
Yeah, it's good to do that insurance check beforehand because there is a lot of variability there. We have another comment that comes from someone who says, I was fortunate to use this Mayo Cardio-Oncology Rehab Center post-chemo. I felt so much better and gained stamina and strength. I did finally try going off on my own to a local gym, but then COVID hit, and I was stuck working remotely and the local gyms closed. Any suggestions on how to start over with a good routine with a local YMCA or other facility someone may have available in their community? I want to know what you say about this too. I think we can all benefit from that motivation. It's easy to fall off the wagon, but how do we get back on?
Well, I'm so glad to hear you're able to participate in our program. And first, thank you. Thanks for the feedback. Certainly means a lot. And glad to hear you're able to continue some of those efforts. But it's very common where one thing or another will come up and we tail off of our program. That's again very common and nothing to get down on yourself about. I often say that kind of the survivorship road is up and down, right? It's not steadily increasing the whole time. There's some hills along the way. And so I would say, maybe ask yourself, how much do I think I could do right now to get started? And I would cut that in half and start at that. So just starting out conservatively, thinking what sounds reasonable and starting well below that, just to make sure that it's going to be tolerable, and that it's going to be motivational to start gradually and get back into it. And I would use those same principles, or maybe adding just 1 to 5 minutes. You might even consider, if you feel you've really become deconditioned, do 5 or 10 minutes 2 or 3 times a day if possible, and build up from there. A lot of programs, again, are offered. YMCA has some great services. Cancer survivors will often ask, will I be able to receive some help at my local facility? And of course, it depends, but I always encourage people to ask. And if they're comfortable sharing, you say, I have some health history that I want to be sure staff is able and willing to help me with. And you can just ask if they're familiar with working with that type of scenario. And if not, you might consider another one. But yeah, definitely the camaraderie associated with those programs can be fantastic. And it's just nice to have a social support system. You might also consider, if you would like to touch base back with us, to even maybe do a video visit. But those are some ways to get started. If I didn't answer your question as thoroughly as you'd like, let me know. I'm happy to kind of dig back into it. Hopefully that's a good start.
Yeah, I would also like to just give a plug for people who have a YMCA in their community to check out a potential Livestrong program that might be there. I know Rochester has offered that. I guess I'm not exactly sure what statuses are with COVID, if people are still offering those as they had in the past, but I know we've heard lots of really great comments from people that have participated in Livestrong programs that are affiliated with a YMCA or YWCA that may be in your community.
I see there are a few questions also on the chat feature, so maybe I'll pull up a few of those.
Okay,
There was a
thanks,
question
Janine.
about any advice for dealing with neuropathy in the hands and feet due to chemotherapy.
Yeah, it's a great question. It's something that we see a lot. There are different things to consider. Usually neuropathy it can vary to the severity, of course. Some people need to use walking devices and so forth. Having neuropathy doesn't preclude someone from doing walking for exercise, but it just brings onto the table extra concern for falls. And so if in a supervised setting, I still encourage people to walk and do those things as tolerated, because it's so important for day-to-day living. If you're in an area where maybe you don't feel as safe, or you have to exercise independently, you might consider something like a stationary bike, perhaps a stationary pedaler, things that you don't have to worry about falls. Oftentimes you find that that's helpful. And if people have lack of sensation in the hands, oftentimes machine weights can be beneficial, so you don't have to worry about dropping hand weights on your feet or things like that. So those are a few recommendations. I hope you find that helpful, but yeah, very common concern, and something that's usually how we would approach it.
On the same vein, there's a person that asked about considerations for handling neuropathy, especially when running. Mm-hmm. Any ideas there?
Yeah, it's similar. We can see different degrees to which people experience the neuropathy. And as most people, if not all people with neuropathy can speak to, you have to be very careful about foot care also, to make sure that there aren't any small sores or things going unnoticed that can lead to complications. But certainly if you're able to run and you feel like it's well tolerated, the balance is there, I wouldn't tell people not to. Again, this is in a setting where I'm not familiar with the entire health history, but if you've been doing it and it's well tolerated, it sounds like it's going well, you can always touch base with your local provider too, just to verify that and any other concerns that go along with it. But that's great.
I'm going to just put a plug into someone else, put in a reminder that Silver Sneakers is another program that's associated with YMCAs, and that's for older, more mature people, but that might be another resource and something to check out. It's called Silver Sneakers at the YMCA. So thank you for putting that forward.
Yeah, no, it's great. Some comment or question is, what are some of the main complaints you might hear from patients when they're beginning exercises? And then how do we keep motivation going to encourage that to be continued?
Yeah, it's a good question. Sometimes, especially when getting started, it feels like maybe it's a chore to get into the routine, dedicating this time off to the side of an already very busy day. And it seems like that can persist for maybe a few weeks, maybe longer. But believe it or not, and maybe a lot of you can attest to it, there is a transition point where you go from suddenly feeling like, wow, this is a chore to maintain it, to I don't feel as good now if I don't exercise. And so if you can stick with it, I think what you'll find is that it just becomes part of your routine and you realize some of those benefits. And that can be very motivational. But again, getting started is oftentimes the hardest part for people that they mention to me. And also, they want to be sure that they're doing it safely. So some of the issues that people bring up, well, I've been told from this person or that person to avoid this. Everyone has family members and loved ones that are having the utmost concern for them, and sometimes are maybe overly protective and say, I don't think you should do any exercise just yet, but just rest assured it's been shown to be very safe to start out gradually and very important to do so, in fact. So those are a couple of things that come up.
Sure. Well, and I was going to just interject too that oftentimes I'll share with patients when we talk about this, when they come into the education center, that I know in my younger years, I exercised more for vanity's sake, right? I wanted to look good. I wanted to have a toned body. And now that has shifted, that my motivator is less on a vanity perspective and is much more for that health benefit. So if you even can view it as much like a prescription. So if I have a medication that I'm recommended to take, or like eating healthy would be another health habit to have, but to put it on that same level of importance as it would be to take my daily medication or to eat my fruits and vegetables, to say that this exercise is doing the body good, whether it's in a small amount or it doesn't have to be an Olympic training event. It just has to be something that we can do to benefit our overall health, and a little bit is better than nothing. So
Yeah, and I've also found, because I can be an exercise resistant person, so I think it's what has been helpful for me is to have a little bit of a commitment with a good friend. You know, that is not pushing me too much, but it makes it a little more fun. But I have a commitment to meet that person, or even if I have a commitment at a gym to meet like an exercise specialist or somebody there to help me, that helps motivate me also.
Those are really good points. I've encouraged people to even put it on the calendar, make an appointment with themselves. People have reported to me that that's very helpful, and always keeping that goal in mind. What is it that I'm wanting to exercise for? We know everyone knows the health benefits, but oftentimes it's those things like attending a wedding, playing with their kids, attending this event. Those are the things that oftentimes can be the little extra nudge to keep people adherent to an exercise regimen. Yeah.
We have a question on thoughts on the use of infrared sauna. Any thoughts there?
That's a good question, and I really don't. I think it'd be beyond my expertise to comment on them one way or another. I think if you have any questions about that, just to discuss it with your doctors. But good question. I know that sauna is something that comes up a lot nowadays. It's more prevalent in literature, but I don't have any comments one way or another, to be honest. I wish I did.
Sure. Another question is there as much benefit to splitting exercise in a day as there is to doing the exercises all at once? For example, doing one set in the morning and one set in the evening for weight training.
Yeah, that's a good approach. I haven't heard before of people kind of splitting it up, resistance training, a set in the morning and a set in the afternoon, but certainly if that's the way that you find allows you to sneak it in, then great. Oftentimes the benefit of doing just a short rest between sets is that there's already that little bit of fatigue that may perhaps help with your adaptations to it. But as long as you're doing each of those sets to fatigue, I think that's a nice way to incorporate it. Good job finding ways to sneak it into your day.
Thank you. And then another good question is, what's the best contact info to discuss some options with your program? So if someone is interested in trying to set up an appointment, what avenue do you think that they should take?
Yeah, great question. There are a few routes that I would recommend. If you have care here at the Mayo Clinic or at any site, I'd recommend that you touch base with your Mayo provider and ask them about it. Otherwise, the most direct way, I'm going to share my screen again briefly, is to feel free to reach out to me, our team, directly. Let me just pull this up, please. The number that you see listed here will contact you with our program. Any staff member that answers should have a good knowledge of our program and answer any specific questions that you have. And you can always ask for me too. If you're comfortable just leaving your number, I'll give you a call back as soon as possible. Yeah.
All right. Thank you for that offer, Adam.
There's one more question I see here is how to start exercise after being diagnosed with low calcium and probably osteopenia, I'm guessing.
Yeah, another good question. With low bone density, if maybe you're referring to osteopenia or osteoporosis, there are a couple of different approaches. For osteopenia, there's the risk of progressing to further bone density decline. And often for that case, weight-bearing exercise is really recommended to help maintain it. Walking is a good example. Not so much unweighted exercise such as cycling. It doesn't have the same benefit, but still beneficial from an aerobic perspective. But also the resistance training will often be recommended. If someone progresses into osteoporosis, then there are certain things you want to avoid, such as forceful twisting or bending of the spine that can lead to some issues with structural integrity, compression fractures, and so forth. But walking and things like that are always recommended. Yeah.
Okay.
Good question.
And here's another one. This is a good one. Any insight on how long a person should warm up before aerobic or strength training exercise? And if a person needs to cool down to prevent soreness? So how should we begin and end that exercise session? What would you recommend for that?
The standard warm-up duration is 5 minutes. 5 minutes sometimes can be an all-out workout for some. The warm-up might actually feel like a really tough workout for someone who maybe is very deconditioned. So you might even consider a minute or two of even seated marching, where while you're sitting in a chair, bringing your knees up and down and pumping your arms at the same time. Otherwise, if you're looking for a traditional warm-up, you might consider walking at a leisurely pace. Again, even below that moderate intensity where it feels like you're breathing a little heavier, it should feel like a window stroll. Do that for 5 minutes, and that will allow your heart rate, your blood pressure, and your blood vessels to get acclimated. It'll help your nervous system and joints get ready for the exercise. So that's a really good question. For some populations, even a longer warm-up is recommended, maybe for those who have coronary artery disease. Maybe 5 or even up to 10 minutes might be better to allow yourself to really get your engine ready, so to speak, for the activity. As far as the cool down, again, about 5 minutes. That's an opportunity to gradually take yourself out of that exercise intensity to allow your body to get back down to that more resting state. And if you can, I'd encourage even some stretching after your cool down. We find at least anecdotal evidence, people report to us a lot that the stretching after the cool down even will help with some of that soreness